We live in a world where there is an epidemic of chronic pain. And my heart goes out to any of you and your loved ones that are suffering from chronic pain. There is also an opioid epidemic as a consequence of doctors using narcotics to try to treat chronic pain. And what's been well understood is that that solution isn't tenable anymore. There is an appropriate use for pain medications, whether it's ibuprofen or narcotics or all the other type of drugs in between, but we definitely need to do better. And at CCIM, our approach is after the diagnostic workup, in which we get to the cause of pain, and that could be neurologic causes, it could be structural causes, it could be functional causes, and that's part of that diagnostic workup to ascertain that. Once we get to a understanding of what's the cause, then we can create a program to resolve it. Two major treatments that we use, in addition to the medical treatments that we would use, are prolotherapy and structural realignment training, or yoga therapy, where we take the principles of yoga and apply them in a clinical context to that particular person for that particular joint issue. So a classic example is the knee injury. We can use a physical exam and maybe MRIs to get an idea of the knee anatomy, the ligaments, how much arthritis is in there, if there's swelling in there, if there's muscle issues, and then if we understood that there is a structural issue with the knee, we can use prolotherapy and yoga therapy or structural realignment training. Prolotherapy is an injection technique that actually started in ancient times. The Greeks and Romans were using it in their time. And it became a scientific mainstream treatment maybe in the 50s and 60s. Now you can check out the journal of prolotherapy.com for the scientific journal. It's an injection technique where you convert a chronically degenerated joint, which a joint is held together by ligaments, and you convert that chronically degenerated joint into a regenerating joint. And the way to do that is to inject where the ligament attaches onto the bone. So ligaments connect bones, and that's where joints are located. If you inject a place where the ligament attaches on the bone, you stimulate an immune response. And that immune response leads to regeneration and repair of that attachment. And that is the only way to regenerate damaged joints. And that's because joints have poor blood flow, so they don't repair on their own. So you may know somebody, or maybe yourself, that has a nagging injury that just won't go away. And that's because ligaments don't repair themselves. Once we do prolotherapy to promote regeneration of the tissue in the joint, then we want to optimize the joint geometry. And we do that with structural retraining, which involves relearning how to walk, sit, stand, optimizing the joint geometry. We take the principles of yoga and we apply them on a one-on-one basis with that particular patient to relearn and create new muscle memory on how that joint should operate.